meeting is being recorded.
Good afternoon. I'm Andrea Williams, Director of the Women's Place, and we're glad to welcome you today to this discussion of the impacts of reversing Roe v. Wade, hosted again by the Women's Place. On June 24th, the Supreme Court released its ruling on Dobbs versus Jackson Women's Health Organization of Mississippi that constituted that the Constitution does not confer the right to abortion. In effect, this reversed the 1973 Roe v. Wade decision and delegated control of the legality in terms of abortion to individual states. After the Supreme Court ruling, the state of Ohio enacted Senate Bill 23, an abortion restriction that had been created but blocked since 2019. This restriction now lowers the limit of abortion access in Ohio from approximately 22 weeks to 6 weeks of pregnancy. There are exceptions for medical emergencies, but not for cases of pregnancy that result from rape or incest. Under this law, Ohio physicians who perform abortions after 6 weeks may be subject to disciplinary action, fines, and fifth-degree felony. Today's discussion aims to provide the Ohio State community with resources and information about how to advance the well-being of women and all who will be impacted by this recent ruling. According to the Ohio Department of Health, there were about 20,000 abortions in Ohio in 2020. In framing abortion access as more than a women's issue, our discussion aims to anticipate the economic, medical, social, and everyday practical ways that people of all gender identities will be directly or indirectly impacted by the ripple effects of this decision. As one sign of the reach of this topic, more than 400 people registered for today's discussion. The urgency of addressing reproductive care with candor, respect, and action has moved attendees from across the political spectrum to join us here today. So I want to thank you again for joining us. Likewise, our speakers for today are offering a range of professional and personal insights. So I'd like to introduce our panel of speakers. Maithili Srinivas is professor of history and women's gender and sexuality studies, where her research and teaching focus on the history and politics of reproduction. She recently published a new book called Reproductive Politics and the Making of Modern India. And she's also written for public audiences about the history of abortion. Maithili also serves as board member of Women Have Options, which is Ohio's statewide abortion fund. Roger Perkey serves as a wellness coordinator for outreach and prevention with the Student Life Wellness Center here at Ohio State University. In his role, he aims to enhance wellness across the student body through trainings, workshops, and programming. His work emphasizes ways to encourage health equity and empower disenfranchised voices. Nicole Patson is Associate Professor of Psychology on the Ohio State Marion campus. She's also an advocate for reproductive justice who has volunteered with local organizations providing access to reproductive health care. She's particularly interested in work aimed at destigmatizing abortion care. And our final guest, Raquel Breckenridge, is the Family Services Director for Permanency, a division at Franklin County Children's Services. She oversees kinship, adoption, visitation, and youth transition services departments at Franklin County Children's Services, and she's been serving children and families in the child welfare field for over 20 years. So thanks again to all of you for being here with us. So let's start this conversation actually with a little bit more context and go even further back than the nearly 50 years that Roe v. Wade was in place. And I'd like for Maithili to begin in talking us a little bit through how did the matter of abortion become so important in American thought and politics in the first place?
Yeah, thank you so much, Andrea and the Women's Place for organizing this event. I'm going to get to the question, but I just wanted to start off by just recognizing that these are very difficult times for many of us who are here. And I just want to recognize and sort of hold space for this. And recognize also the grief and the fear and the anger or concern or anxiety that people may be feeling for themselves and their loved ones and for people in their communities right now, which is a period of great uncertainty. So I just wanted to start off with those comments. But yeah, to the question of how abortion became so important in kind of American political life, there's a really long history to this that I'm going to try to talk about really briefly. But when I teach about this, there's sort of two things that I want everyone to know and remember. One is that people have had abortions throughout human history so far as we know, and they'll continue to do so, whether or not it's legal or not legal. That's a fact. And secondly, abortion was not always so controversial as it is right now. And even when it has been controversial at specific historical moments, the reasons for controversy varied. So in other words, people have had different reactions to abortion across time and place. And so the reason I emphasize this is that there's nothing natural or inevitable about where we are today, right? So kind of growing up in or being in the world that we've been in for the last, I would say 50 years at least, but a century maybe, we sort of assume that, well, of course, abortion is this controversial point that people are going to be fighting over, but that's just not true, right? And we can look at history and other parts of the world too to sort of think about how that's the case. So here's my very brief history lesson of like a couple of key points, really brief. One, abortion in the United States was not always a crime. So until the 19th century, it was not criminalized before a person could feel fetal movement. That was called quickening. And so since it wasn't always a crime, we have to recognize that abortion was made a crime at a particular time and place. And so the most immediate reason for that was a campaign in the 19th century by the American Medical Association as part of their own drive for professionalization and a desire to assert authority over midwives who are their competitors and their pregnant patients. So there's a lot to say about this, but I'll say one thing is that this drive, this sort of initial anti-abortion campaign, was linked to a lot of other things in American society back then that will still resonate with us now. It was linked to concerns about immigration, to concerns about the racial composition of the US after the end of slavery. And it got tied to nativist ideas about the reproduction of the white race, right? So this country has always been really interested in who's reproducing and when and how much, right? There was the control of enslaved women's reproduction during the period of slavery, and then post-slavery, there was sort of like this shift towards the sort of reproduction of the so-called white population. So by the 1870s, this is like the part two of the two-part history here, abortion became illegal in all states. And that's what Roe overturned in 1971. So it's important to recognize that 1971 didn't mean that was the first time there was sort of legal or non-criminalized abortion in the US. It was just the moment where there was a shift again. And there are a lot of reasons why Roe was decided this way. An important one was that pregnant people kept having abortions. Going back to my earlier point, people have always had abortions, whether it was legal or not. And many of these abortions were unsafe. So medical professionals and others began to lobby for having legal abortion as a way to have safe abortion. And they joined a feminist movement which pushed for legal abortion as fundamental to women's rights. Now, since Roe has been decided, right, for nearly the last 50 years, there's been organized opposition to the decision. We all know that. And abortion rights have been continuously reduced and limited for decades. So yes, the Dobbs decision is huge, but actually access was being limited to abortion, especially for low-income folks and people of color for a long time. And just like the last anti-abortion wave in the late 19th century, this is not just about abortion, I think, but is connected to a lot of other goals and interests. Some of the same ones that we've had before, right? It's become a litmus test of right-wing politics. It's been the same politicians who are anti-abortion also tend to be anti-immigrant, anti-LGBTQ rights, anti-Black Lives Matter. And I'm talking here about politicians, right, and leadership who are taking this position. And many have been opposed to the gains of the feminist movement. So when I think about overturning Roe, I don't just think about abortion. I think about this decision in the context of kind of rising right-wing politics across the country, which attacks not only women and people who may become pregnant, but all oppressed groups. And second, I think about the Dobbs decision, right, from this long history of the fact that people are still going to need abortions and they will still try to get them. So the question now is that the Dobbs decision makes that much more difficult for many people, and for some people, it makes it less safe as well.
And you're starting to gesture again to how these rulings relating to abortion rights are important, but that actually they gesture out to so many other categories of rights in existence. And so I wondered if you could keep elaborating about what are some of the other areas of everyday life beyond the status of pregnancy that the reversal of Roe v. Wade might be affecting and impacting for Ohioans.
Mm-hmm. Yeah, thank you. I think in political terms, I think that limiting rights in one area, right, in this case, abortion in the Dobbs decision, will necessarily shape how all of us access rights to healthcare, to citizenship, to employment, to bodily autonomy, right? There's a whole range of things that that the regulation of pregnancy also affects. And as you mentioned before, Andrea, Ohio now has a 6-week abortion ban, which, by the way, is earlier than many people realize that they are pregnant. So in many ways, I think it's important to recognize that the 6-week ban is also preventing the vast majority of people from seeking legal abortion care. So just to sort of put that out. But in practical terms, limiting the right to abortion has been shown to have negative impacts that ripple out far beyond abortion itself. And the best known research on this, which I'll point to quickly, is something called the Turnaway Study. It's gotten a lot of media press because it's such an important study. This was a study that started in 2008, and it's a longitudinal study, so it's sort of studied folks over time. And the Turnaway Study compared people who had obtained abortions with people who were not able to obtain them, who were turned away at a similar stage of gestation for various reasons. And what they found is that people who were turned away from abortion care had greater economic hardship and insecurity even years later. And they and their children were more likely to live below the federal poverty line. People who were turned away were more likely to stay with a violent partner. And people who were turned away were more likely to have health problems, again, also years later. That's just a couple of the findings. You can Google it. There's a lot of cool fact sheets if you want to know more. But I think the point is clear, right? That the entire lives of people who want abortions and who cannot obtain them, alongside the lives of their families and their children, are affected for years. And I think we can see those ripple effects, or we will see them sort of as part of our everyday life here in Ohio, right? This is going to have an impact on our healthcare systems. It's going to have an impact on our schools, on rates of poverty, potentially on rates of intimate partner violence. I mean, there's sort of all kinds of measures that we can look at to think about how this is not just about whether a person gets an abortion at a particular moment, but how it shapes their whole life and our whole society. So I'll pause here. I have a couple more comments, but I can always come back in.
Thank you, especially for mentioning the Turnaway Study, which reminds us that as we talk about the implications of the limitation of abortion care, we don't have to conjecture. We don't have to guess. There have been a number of studies, including that one that followed 1,000 people over time to see what their health outcomes were, what their economic outcomes were, what their career trajectories were. And I think, as you note, some of those impacts had to do partly with economics, but also with the care that those pregnant individuals received during their pregnancy tended to be worse if they were denied abortion. Mm-hmm. I think, too, that throughout our conversation, we'll begin to talk about what this might mean about pregnancy rights and privacy rights in other ways, and to bring home as well some of the other resources that we can be looking at. I want to also put in a word for the OPEN project associated here with Ohio, and that's the Ohio Policy Evaluation Network. And this is a study including a number of scholars here at Ohio State who've been examining the availability of reproductive access in Ohio and in surrounding states, including Kentucky, West Virginia, and so on, and being able to think about what that means when people's drive for abortion care moves from about 27 or so miles to over 150 miles as restrictions are put in place. So those are some of the kinds of considerations that we're going to be coming back to. And later in our conversation as well, I think that we'll bring up what does this mean for the support of families altogether, because this reversal may actually have some real changes to the structures of families and the needed supports for them. But especially since we're here on a college campus, I'm going to bring this home a little bit more for what this might mean, not only for employees here at Ohio State, but specifically for our student population. I know, for example, that this issue of sexual health and reproduction, really hits home on college campuses. And we know that students often come to college with somewhat uneven knowledge about reproduction and safe sexual practices, and may then be prone to unplanned or unintended pregnancies. So I'd like to introduce Roger into our conversation a little bit more here too. And Roger, could you tell us a little bit more about how Ohio State students are currently accessing sexual health education and birth control?
Again, thank you, Andrea, and thank you for everyone who is attending this really important conversation. It's really an honor to be involved in this conversation. So today, I'm certainly going to be highlighting a lot of the resources that I represent as part of the Student Wellness Center, but I do want to take a moment to highlight the great work being done by colleagues and student organizations across Ohio University as we are having this conversation, right? But I do want to have this stark dichotomy between my colleagues in student health services and what we are able to offer students in the Student Wellness Center. Student health services, they are amazing colleagues, amazing partners doing great work in this, but we also have to acknowledge that they are a clinic setting, right? So we have some barriers innately in place whenever we are talking about the clinic setting, a confidential setting with access to a pharmacy and all the medical education that comes with it, versus what we consider ourselves to be a private setting, right? We are never going to be billing and charging for insurance, right? There are no barriers in place to utilize our services. So I really like to start off with that whenever we have this conversation, because health services, they're able to offer full-fledged services, but that may not always be relevant or applicable to students who may have some concerns whether or not that bill is going home to family members. We don't have those same types of conversations. Now, getting directly into your actual question, what type of work around contraceptives and work around sexual health education are we able to offer here within the Student Wellness Center? We do a couple of things. I'm going to highlight a few that maybe some individuals aren't fully aware of, but for those individuals who are interested in purchasing barrier methods, contraceptive, we actually have a group and organization known as the Condom Club. And I do want to spend a moment to kind of like really dive into what this is, because we are talking about students who are coming in with, you put it beautifully, an unbalanced education on what sexual health means and what it means for them. Our program is designed for individuals to come in. We show videos on consents and appropriate utilization prior to anyone being able to be approved to join the condom club, in air quotes there. After that, there's a short quiz where individuals are required to show that they've retained some of this knowledge about appropriate utilization. What does consent mean? From that point on, they're actually able to purchase barrier methods from us at a discounted rate. For $5, we will sell students up to 25 barrier methods, and we use that language very intentionally. Oftentimes individuals come in and they're thinking of the external, oftentimes equated to male condoms, and that is not just what we sell and offer to our students. Internal condoms as well, dental dams, finger cuts, lubrication, any other types of services individuals may be interested in, we can get access to. And if we don't have access to it, we have relationships with community partners where we can send them as well. Beyond this, we partner with individuals across campus to offer this free of charge for various programs and other groups. When there is programming or events in the residence halls, we can offer barrier methods as giveaways and promotional items to ensure that if they're going to be having these conversations, they can really be drawing people in to make sure that they are centering good, safe decisions into their work. Now, another part of this is the proactive, preventative piece that we are doing with students across campus. We have a team of individuals that we call the wellness ambassadors, a passionate group of students around safer sex practices and health education that will actually go to student organizations, classrooms, residence halls, really anywhere that we can and hope to be invited into to share this conversation. And we start with the basics, because we understand that not all individuals are coming in with the same level of health information, right? The same level of basic sexual information. So we start with basic anatomy and we work our way beyond it. And these are coming from peers. We use a peer-based model. So these conversations aren't coming from an individual like myself or a staff or a faculty member, but they can engage with the students who are trained on these topics and inherently passionate about these topics to be able to connect more one-on-one or in group settings on this. And I will kind of end with this just by saying is, at the Student Wellness Center and across campus, we are looking to spread this information as much as we possibly can. And so I do encourage anyone who is in a position, whether this be a place of faculty or place of staff or opportunities to engage with other student populations, take a look at some of the work that we are doing and let us help you so we don't have to recreate this wheel, because we would certainly love to be able to get our information and support individuals beyond what we're currently doing.
That's great. Thanks again so much, Roger. And I too was highlighting some of those to be able to really foreground some of those resources on the Women's Place website as well. One of the things that you noted, for example, is the way that consent plays into part of the education that you provide. And again, that will be especially relevant given that the new legislation does not make carve-outs for pregnancy as a result of rape or incest. So that's going to be especially important. Now that this is in place, we know that abortion care will be more limited for people, including students in the state of Ohio. Again, in around 2020, about 59% of people who were pursuing abortion were in their 20s. And so that often overlaps with the category of college-stage students. So I'd like to have you to think a little bit more about what might this mean for Ohio State students, whether that is economically, academically, to what extent does your office or the Student Health Services Clinic actually respond to students who are pregnant?
Yeah. So some grounding information. We have consistently utilized language and a holistic wellness model based around what we call the 10 dimensions of wellness. So just some grounding information for those in attendance. We know that individual students are not unidimensional beings, right? The way that their career aspirations are connected to their emotional well-being, are connected to their physical well-being and their spiritual well-being. It's a spider web. And if you are a deficit in one of these areas, it is more than likely going to show up, whether that be in your academics, your personal, or your social life. So at this grounding place, we want to make sure that when we're talking about this, we're acknowledging all the dimensions of the students, right? So when you talk about the financial component as compared to the physical component, again, the deficit in one can have some dramatic effects in another location. So with that being the grounding conversation, what we are hoping to do and what we are really trying to do is help people understand this. We call college, right, the formative years oftentimes of students. Well, what that really means is they're still trying to figure some things out. They're learning. Foresight and future planning may not always be fully developed for the individuals that we are working with. And for a lot of that, what this means is the idea of family planning and being able to put this in perspective is oftentimes not going to be high on the docket for individuals. Individuals that we are working with, this comes oftentimes at a surprise. This comes as someone who is finding themselves in a very uncomfortable, scary, and tenuous place. They don't know what their options are. They don't know kind of where to go from this. And we see this as a couple of pivoting points, right? We're not always going to be the experts in being able to help and assist. Being able to get our students to appropriate community partners or campus partners is always going to be a grounding point for us to start, right? Because we have to acknowledge kind of where that line in the sand is. We are great when it comes to education, but we're never going to be those practitioners. But we can be the listening ear to make sure that people are able to be heard, listened to, and then provide them the next step. Now, what we do want to make sure everyone is aware of whenever we are having these conversations is for an individual who finds themselves pregnant, it is not simply going to be this physical component. I want to draw this back to how I began this conversation, right? This is going to change the mindset of an individual, right? Someone who may have XYZ career aspirations may now need to focus on, am I going to be able to complete this degree? Do I need to now pivot to a place where I can take care, provide, find additional type of assistance, bringing in some of the idea of the economic stability, being able to think about how am I going to be able to achieve whatever this is, ABC 1, 2, 3 that I previously had hoped or aspired towards. And it began to take some mental and emotional tolls as well. So again, it's never going to be simply one category. It's how are we going to be able to take care of the physical needs from more of a health services, the general education of options that we can offer as well in the Student Wellness Center, but also being able to pull in our colleagues and our counterparts in counseling and consultation services to be able to sit with an individual who may be in emotional and mental distress at this point, which we know does not have a caveat for the current legislation as it's been written. So it is a multifaceted approach where we try to be as interdisciplinary as we possibly can to acknowledge where our strengths lie and how we can bring in partners as necessary.
I appreciate that you bring up, for example, what this may mean for students' time to degree, academic achievement, enrollment rates, dropout rates. And in that regard, I'd like to mention 3 resources in particular for students who are student parents. One is the Critical Difference Reentry Scholarship, which is available for students who have taken 2 or more years out of their education for extenuating circumstances, whether that's parenting, other kind of caregiving, as well as military service, illness, and so on. But that is one of the resources that's useful. A second is through the Office of Diversity and Inclusion. There's also the Access Collaborative program. And this is a program that offers academic and social support services for student parents, as does the Campus or C-Campus program, which stands for Child Care Access Means Parents in School. And there really is support for parents who might have children between the ages of 6 weeks and 12, including afternoon or evening care between 6 and 10 p.m. So there are those kinds of options that are available. I want to highlight in particular the Critical Difference Scholarship as one that was founded early on, even before the formal founding of the Women's Place at Ohio State, because women and their allies recognize the ways that the career and education of people are associated with autonomy that they have over some of their reproductive planning and career strategies, and really wanting to overcome some of the penalties that before Title IX in particular were legalized and okay to say that you're a pregnant student and you will be expelled, or that you're a pregnant employee and won't be able to continue. So many of these kinds of reentry grants and other services have been put in place to try to ease that pathway and to be able to give people more of a sense of choice around some of their timing as well. So thanks for mentioning those. As we move on, I know that we're already starting to get some questions in the chat that are specifically about, so what does this mean in terms of healthcare access for many of us here who are Ohio State employees, for example? To clarify, we did reach out to Human Resources, which verified that our Ohio State Employee Health Plan does not cover what's sometimes called elective or non-therapeutic abortions. Also, the Wexner Medical Center does not perform elective abortions. So with that in mind, Nicole, I'd like to have you to maybe talk a little bit based on some of your volunteerism as well about what are some of the other community resources that people at the university and other Ohioans have been seeking for reproductive, comprehensive reproductive care.
Yeah, so thank you. I want to thank again the Women's Place for organizing this important discussion. I want to thank my panelists for joining in this discussion. I've been taking lots of notes. And I also want to thank all of the attendees for being here today. So before I talk about what resources exist, I want to just talk a little bit about abortion stigma, because abortion stigma drives, it has a lot to do with why abortion access is limited and why information about abortion care is obscured and limited. So when I talk about abortion stigma, right, I'm talking about this negative attitude that we ascribe to people who seek to terminate a pregnancy. And it is really grounded in our ideas about ideal womanhood and femininity, right? So a woman who chooses to terminate a pregnancy is seen as sort of failing to uphold the ideals of womanhood. And so because we have that sort of stigma in our culture, women who seek abortions are regarded are seen as selfish or promiscuous, irresponsible, heartless, and abnormal. And so because of this, people who seek abortion care often don't talk about their experience, and that affects all of us. So all of us then think that abortion is much more rare than it actually is. So as we heard at the beginning of this discussion, abortions have been happening throughout human history as long as we know. And in fact, 1 in 4 women will have an abortion in her lifetime. So we know that women are not the only people who seek abortions, that Those are the statistics I found. But we know that other folks also need access to abortion. I think that when we talk about abortion, we can't, so when we're having conversations like this, we can't, one of the things that we can do if we want to, if we care about access to abortion care, is to think about the language that we're using when we're talking about abortion care. And, you know, some of the things that, I mean, we've all been hearing in the media, you know, folks talking about, you know, using language that stigmatizes abortion, saying things like, I'm pro-choice, but I'm not pro-abortion, right? That suggests that choosing abortion is an inherently bad choice and one that we don't support. Using terms like pro-choice and pro-life can be stigmatizing as well. So we can talk about, you know, people who are working to advocate for abortion access, people who are anti-abortion access. That's you know, those kinds of terms are clearer about what the goals are. And so I think I'll stop there in terms of just talking. I can talk more about some of the language that we hear around abortion stigma, but the reason I want to talk about that is because we don't talk about abortion access, many people are not aware of how one seeks to get an abortion if they are choosing that option, right? And currently, because of the court decision to overturn Roe v. Wade, it's very confusing and things are changing very rapidly. And so that makes things difficult as well. So what I can share is that, as we heard at the beginning, abortion is still legal in Ohio up to 6 weeks. In order to get abortion care, you need to go to an abortion clinic, and there are 9 abortion clinics in all of Ohio. So again, I just sort of echoing the comments we heard at the beginning, since Roe v. Wade went into place, there have been systematic attempts to restrict abortion access. So as of 2021, there were over 1,300 different legal restrictions to abortion access. So there are 9 clinics in all of Ohio. That, just to give you an idea of the history of that, in 1982, there were 55. So abortion clinics have been systematically targeted with a legislation that has made it difficult for them to remain open. So 2 of those clinics are in Columbus, and none of our regional campuses are in counties that have access to an abortion clinic. So as we said, the law currently allows abortion care up until 6 weeks. That is before most people know that they're pregnant. So many Ohioans who need to access abortion care will need to go out of state in order to do so. Michigan and Pennsylvania are the 2 closest options. Then in order to, so that's where abortion care is provided. Federal money cannot be used. So folks who are on Medicaid cannot use Medicaid to pay for their abortions. Sorry, I'm looking at, I've got 2 notes in 2 different places. So the second thing I want to talk about is support that exists for people who are seeking abortion care. So abortion funds are one source of support. Women Have Options is the statewide abortion fund here in Ohio. Women Have Options provides funding for people seeking abortion care. They can provide help with transportation, help with childcare. 60% of people who seek abortion care are already parents, and sometimes access to childcare can be a barrier to accessing the abortion care someone needs. So abortion funds are one of the important ways in which people are getting access to abortion care here in Ohio.
Thanks for
Yeah,
listing, listing too and thinking about how many of these logistical issues of transportation, of childcare during the procedure, of time away from work could be complicated, for example, for people who now are driving further to have access to that kind of care. Michael Lee, I know you'd like to jump in here as well.
Yeah, thank you. I just wanted to, thank you for mentioning women have options. And I wanted to also add in, I guess, sort of two things in addition to that. One is the commitment of Women Have Options is to support everyone who needs abortion care. The way in which the organization is doing that is having to keep shifting because of the changing laws and the uncertainty of the legal landscape. So if you think you're in need of abortion care, timing is everything. So it would be really important. I think this is an important message to get out to students and everyone, that the sooner you think you're going to need help, the sooner you should reach out, and especially for Women Have Options, because that'll really shape, among other things, where you might have to go to receive care and, the costs of that. So I just wanted to sort of put that out there, and also to recognize, to just sort of like re-up Nicole's point that abortion funds, including Women Have Options, don't just fund the cost of abortion care, but all of the associated expenses, or we try our best to fund all of the associated expenses along with that. Okay, that was it.
Thanks for that. I think that these kinds of clarifications are really important, because following the rulings, a number of articles, opinions, social media posts have been flying, and some of them might have mistakenly or even intentionally passed along miscommunications or misinformation. So conveying the message that abortion is still legal in Ohio, but that it has been restricted in terms of the timeline for that is important. And then also, I think we've dropped the link for Abortion Finder in the chat for people to be able to work with that interactive tool. But two, I think that some of the information and misinformation, perhaps, that's been flying around in the last couple of weeks has raised people's anxiety about entire access to contraception. So, for example, one needs to differentiate between Plan B as emergency contraceptive, which has not been banned, and actual medical abortion by pill. And that is under the same laws as the 6 weeks ban. So again, to differentiate, there's a difference between Plan B and what some people call the abortion pill. So with that in mind, I do want to start taking on some of those kinds of audience questions that we're getting when people are concerned about what else might this mean for access to contraception, or is it still legal for people to receive medicine for pregnancy termination through the mail? So what are any other clarifications that anyone on the panel would like to make about reproductive care?
Yeah, so I think that accessing medication through the mail is so it is not illegal, and there are resources to help people figure out how to get access. So plancpills.org can help folks find access to those. Of course, those again would not be covered by insurance. If people are, so if you're obtaining those outside of an abortion clinic setting. Someone in the chat did note House Bill 598 that's currently in committee here in Ohio. So the Ohio legislators are on summer recess at the moment. But that bill is still in committee. It will ban, if it's passed, it will ban abortion in Ohio. fully, except in cases of medical emergencies, but it puts a burden on accessing that care as well. It also has some medically, so I guess I shouldn't say too much since we don't know what the final bill will look like. Currently, there are no bills in consideration to ban contraception and other contraceptive methods in Ohio, but it is something that people should be paying attention to. And as we're watching what happens in other states, I think it's also important to know that that is relevant to what happens in Ohio. So even though bills are passed at the local level, there are organizations who work at a national level writing those bills and sharing them with state level legislators. So paying attention to what's going on nationwide will also be important for us to anticipate what's ahead.
Great. I think also too, there are some questions coming either in the chat or in the question and answer function. And again, for clarity, we do encourage you to use the question and answer function, which allows for us to centralize those. But there are some questions that are coming up about kind of medical exceptions. So I'll say, as part of my immersion in this topic over the last couple of weeks in particular, I also viewed a panel that was hosted by Columbus Dispatch and moderated by opinions editor Amelia Robinson. Just the other night, our own Ohio State co-director of Open, Allison Norris, was part of that, as was Representative Allison Russo and a number of other speakers. And one of the things that they tried to highlight there is that ectopic pregnancies, tubal pregnancies, other kinds of pregnancy complications are still covered under the law, or covered in terms of being exempt from banning under the new law there. So questions about whether those kinds of pregnancies that are non-viable will be able to be terminated. That is, again, one of the distinctions that's often made between what's called a therapeutic or spontaneous abortion versus an elective abortion there. As we are kind of moving on as well, I know that our conversations earlier have responded to and given information both about abortion care and access, also about support for those who do plan to continue as caregivers, as when I mentioned some of those resources for student parents. And I think that increasingly after Roe v. Wade, it may be that even more people are considering some of those supports for pregnant individuals as well as children and families. And that's where someone like Raquel comes in and talking a bit more about Franklin County Children's Services, as well as other community-based organization and resources. Often one of the kind of rationales or arguments on certain sides of the debate is to say, bring that child to birth and then consider placing someone for adoption. And so I wondered if you could talk a little bit more, because even though that's often a response, I feel as though many people aren't familiar with the process, the timeline, the cost, the eligibility associated with the abortion and with adoption. So could you talk a little bit about those things, the demographics, the timelines, the process for adoption, both from the position of the person placing a child for adoption and for those interested in adoption?
Right. Good afternoon, everyone. I missed the first part of the session, so I apologize. I had some connectivity issues. In particular, with our agency, Franklin County Children's Services, we deal with mostly adoptions through the child welfare system. So those are kids who may have been deemed abused, neglected, or have a dependency, and sometimes a deceased parent, and there's no other permanency option for them. I also oversee our adoption assistance program, and which is where we see a lot of private adoption or possibly post-adoption services. So for a person who's interested and make an adoption plan while they're pregnant, there are several state-approved licensed adoption agencies available in the state of Ohio that work with both the birth parent and also prospective adoptive parents to develop an adoption plan. The first step in the process would be for an individual considering adoption would be to research and select a licensed approved agency through the state of Ohio if they plan to do an adoption in Ohio. Those adoption agencies should provide education, linkage with resources, counseling, and also meet the level of support that that person needs in making an adoption plan. Each agency has individual services that they offer, but typically it's up to the individual to make the choice on what agency they would like to pursue an adoption plan with. Private adoption are very costly. The average cost for a private adoption is about $25,000 for all funding that is needed. Another avenue for adoption is through the child welfare system. There's also private foster and adoption agencies that are licensed through the state of Ohio that provide support to kids in foster care for fostering, and also families who want to just adopt either privately or through the foster care system. JFS has a website currently that they list current license providers. If a person who's interested in making an adoption plan, or also anyone interested in adopting, there's that resource out there that you can search your area to see what agencies in your area offer foster and adoption licensing, training, resources, and things like that. The process for adoption and per se private, I'll go with an infant if you choose to make an adoption plan. The individual makes that choice on the family. They are ultimately given that decision on making an adoption plan, choosing a family that is licensed while they work with that agency. They decide the level of contact after birth, whether it's going to be an open, semi-open, or private adoption where they want no contact. That's all built in developing that plan for adoption. So each person has an individual plan. Generally, after the birth of a child, if you chose to place a child for adoption, that adopted parent is there at the hospital upon delivery. The biological mother has the option to either not see the baby at all and just release to an adoptive parent, or they can have time to at least have some time at the hospital to see the child, ask any questions, if anything happens during that time, maybe they, change their mind. There are guidelines and resources they can do to do that should that happen. But generally after that birth occurs and the adoptive parent goes home, then it becomes a legal process. A child has to be in placement with an adoptive parent for a certain period of time, generally in the state of Ohio, 6 months before they can actually legalize an adoption. But temporary custody is given to that prospective adoptive parent so that they're able to meet the needs of the child up until the time that they legalize an adoption. From there, again, whatever adoption plan that they've made plays out depending on the birth parent and also the adoptive parent.
So what you've done really highlights too how even someone placing a child for adoption still has certain rights throughout that whole process that need to be honored, and needs to identify an agency that would allow for them to extend those along the way as well. And also too, that there are economic and other support services for people who plan to place a child for adoption. And I think this question helps to highlight that. And I appreciate again Nicole saying, let's not call it pro-life, pro-choice, because it's squarely about adoption care itself, right? But that people on various points of the spectrum of their attitudes around that can probably agree on the point that what we also want is better care for individual people's health and for children and families. again, giving some flexibility or independence for people to be able to make some decisions around that. So this might be a time that not only are people working in terms of grassroots organization, as well as kind of legislative debate, but it really could be a time for us to be able to think about more resources, things like universal parental care and leave that aren't even in place in the United States, or affordable childcare. So I'd like for Raquel, but really anyone, to talk a little bit more about how could we use this as a historic moment to advocate for what's good for women, what's good for children, what's good for families, recognizing that those three are different, but they may sometimes overlap as well. So how is a way that we could really use this as a time to be advocating for more structural support?
From the side of children and families in particular, I think number one, we're going to see an increased need for both foster and adoptive parents, those willing to step up and take care of a child. I also think more education, financial supports, and resources for those individuals that want to assist in caring for a child. And that includes kinship caregivers, foster parents, and or anyone adopting, because there are times when there is what we call relative adoption, where a young person or anyone choosing to place their child for adoption can place with a relative for adoption or step parent. There are limited resources for kinship caregivers and possibly step parents than there are today for those families wanting to adopt. For adoptive parents, there are a little bit more resources available. So I would see some advocacy needed for those kinship caregivers and for those who wanting to foster, to be able to financially support caring for a kid, because they still have the same issues that any person, birthing a child. Access to affordable childcare, as you know, is a number one, especially what we see in our system with kinship caregivers. When you have 2 or 3 smaller children in daycare, it could be very costly. Financial supports, crisis support, I think it's definitely needed as far as parenting, small kids or kids with special needs and things like that. I think there needs to be more advocacy for those type of supports in the community.
And I think too, the point that you bring up about kinship care makes me think about in my own family and likely other families of color, how simply taking in that niece or nephew or something is very common. But as you mentioned, there isn't the same kind of official financial and economic support for that. I think that reiterates again the ways that lacking access to abortion is going to disproportionately impact women of color, low-income individuals. We need to also mention many of us very strategically have been using the term pregnant people or pregnant individuals rather than simply pregnant women, because also trans individuals might find themselves pregnant and need the same kinds of resources either for adoption or abortion or for bringing a child to birth and having support during that time. So these also are folded into our thinking more structurally about support. Michael.
Thanks. I also when you mentioned, Andrea, about women of color and Black feminists in particular, I wanted to talk about reproductive justice as a way to kind of think about this moment. The idea of reproductive justice came from the work of Black feminists who talked about it as the right to have children, the right to not have children, and the right to raise the children we have in safe and sustainable communities. And I think that all three are sort of part of a whole and can't really be disaggregated from each other, right? So the right to have children, involves all kinds of social supports for that, as well as, medical supports in some cases. The right to not have children obviously includes rights to contraception, but also to abortion care. And the right to raise the children that we have in safe and sustainable communities includes all of the kinds of things that we're talking about here, whether it's sort of support for kinship care, support for folks who raise children who are not their biological children. I think there's just sort of all kinds of directions we can go. So I just wanted to sort of put that out there and sort of give a shout out to Sister Song Reproductive Justice Collective, which has sort of done the work of putting that vision forward and sharing it with many of us. I don't know if you wanted to talk about, to take up any of the questions right now, because I also want to talk about crisis pregnancy centers, because there were so many questions.
Feel free.
Okay, so yeah, so just, and I'm gonna put a link as a shout out to a former student in WGSS who did some research on crisis pregnancy centers, and that was published in the Dispatch, so I'll link to that in a minute. But crisis pregnancy centers, everyone should know, are not abortion providers, and they do not refer people for abortion care. And I think that's just a critical distinction to know about. There are more crisis pregnancy centers than there are abortion providers in the state of Ohio. And I think, although I don't have the figures in front of me, that's true nationally as well. And so I'm not really the best person to speak about what crisis pregnancy centers do provide. But I just think that I've had people come up to me in the past who have been confused about the place where they went to. They are pregnant, they're not sure where to go. And often these turn up first in Google searches. But to recognize that crisis pregnancy centers do not refer people to abortion care or even introduce it as a possibility. So it's kind of on us, due diligence when you're looking to be aware. And if you're unsure at a clinic, to just straight up ask, is this a facility that provides or refers people for abortion care if that's what they need? And I'll put that link up in just a minute.
Great. Nicole.
Yeah, I wanted to jump in on that topic as well, because I think it also touches on privacy issues. So crisis pregnancy centers are not medical facilities. And so therefore they are not beholden to HIPAA laws, right? They don't have to keep your information private, and they rarely do. So that's something that, as the laws are changing, we should all be mindful of how to keep our information private, using, so searching for access to abortion care, using privacy. Private people are recommending advocates are recommending using private browsers. So law enforcement does have a history of using people's Google searches and phone conversation, chat conversations to prosecute. If going to a crisis pregnancy center and saying that you're seeking an abortion is information, right? If you share your name and that kind of thing, those groups, like I said, don't have to maintain privacy because they are not medical providers.
Yeah.
Oh, and sorry, then the other thing I just wanted to say is that the abortion funds all list the real abortion clinics in Ohio. And then ineedana.com is doing an excellent job of maintaining an up-to-date list of all of the abortion clinics that are open in the United States. So as clinics are closing, they're keeping up to date with that.
In relationship to this question about how information circulates, how privacy around that information works, and so on, I'm going to come back to Roger with a question that I see from a viewer who says, as public employees here at Ohio State, do we have any restrictions on how much information we can provide to students?
So this is an interesting and somewhat challenging question to answer. So I'm going to speak from a personal place, what we can and what we will continue to do within the Student Wellness Center specifically. Education is education. We will continue to make sure people are aware of what legislation currently is, what we are able to offer here and around the area. We also have language which is used really intentionally. But if we are unable to provide this XYZ. Here are some local support resources and some great places for you to educate yourself on where you can get some more information. So luckily, as an institution, we are not offering abortion services, right? So this is not something that where we have to worry about what we are offering or what we are not offering. Information is free. And as long as we're providing accurate information, we are not restricted. We make sure people are aware of exactly what's been already mentioned most recently by what is real, what is a fake center, and we provide people with access to local community resources. So the simple answer is not necessarily restricted. We do have to be mindful of how we are representing a public institution, which I do want to take a quick pause. I saw some conversation in the chat earlier about someone who mentioned that they were so happy that this was being put on because they were so disheartened by the overall university response. I'm one person, but I can tell you, speaking on behalf of my office, we wanted a certain response. We wanted to provide a certain response, but there are some things that we are unable to do as a department or even as a unit. So when it comes to individual conversations, we are not as restricted. When it comes to how we are outwardly facing as a department, as part of the Ohio State University, there's some limitations on how we can share things and display things that are politically charged or politically affiliated. But behind closed doors for conversations, no, not necessarily.
Okay, that's a very important point to make for people who are faculty and staff advisors or who work closely with student groups. I think also it underscores perhaps one of the utilities too of having peer-to-peer education, as you're mentioning, Roger, so that that information is passing peer-to-peer among students rather than from a position of authority that some might consider coercive rather than neutral. Roger?
Yeah, I cannot stress that enough. We intentionally employ, I shouldn't use that word, but we have a model based off student volunteers, individuals who are individually passionate about this, who are able to share this information after going through training, like a train the trainer model. So this is information being shared amongst the students after we have made sure it is accurate. Those conversations are much more impactful, and they also have lessen limitations on those types of conversations that students can have amongst themselves as compared to what maybe a director of an office at OSU could have with a student.
Great. There are some questions here as well, and getting us to think about what might limited access to abortion or questions around reproductive care mean altogether for the working conditions of people either at Ohio State or more generally. I know, for example, that statistics have shown that even given the childcare demands on people during COVID, that there are now 650,000 fewer women in the workforce than there were before the pandemic. And again, maybe not all of those can be contributed or attributed to childcare, but we know that parents and those who cared for individuals who had disabilities were disproportionately facing additional labor. Even the Women's Place survey that we conducted in May of 2020 reflected some of that about our own campus. So what might the restrictions on abortion or changes in reproductive care access mean for working women or for working families? And then linking this back to workforce and economy. We've seen some early kind of statistics, for example, trying to think about how much in lost productivity might that mean. Any other ways to think about what this means for women's work, especially on the 50th year anniversary of Title IX?
I don't have stats off the top of my head, and I'm wary of a framework that just talks about productivity, but I will say that, we live in a society that has limited or to no paid family leave for caregiving. And I think that has to be part of the equation. And that's, I mean, I guess to me, what I'm saying is we're sort of living in a regime that is reducing people's choices about whether or not to have children, and at the same time in a society that doesn't support people's choices to have children. And I mean, I'm just not even quite sure where to go with that, except to sort of point that out, right? That it's not that that the Dobbs decision is leaking into a world where there is support and care or help for people to remain employed when they have children, because we don't tend to have that. So I guess I would also maybe turn that around and ask what some of the other panelists are thinking, because I'm seeing some of the recent questions that are coming in on the chat, and the real frustration, which I share, about what can we do, both as individuals, but also as folks here at Ohio State, and what the institution can do. I hear what you're saying, Roger, about what the limitations are. And, you know, I'm not a lawyer and I don't know what those are, but I do, I just want to recognize the frustration that I'm also hearing from folks that our institution is not doing more. And I know, for example, I don't think this is a solution, but you do keep hearing about the various, you know, companies and corporations that are providing support for people who have to travel to access abortion care, as just one example of what's going on. And so I just wanted to put that out to other panelists about where their thoughts are on some of that.
Yeah, I think that, I mean, I share the frustration. I suspect that OSU won't provide that kind of access to employees, and I'm concerned about privacy. So if someone does have to take off time to go and access abortion care, will that information, you know, will that information be private? How is OSU going to handle that? You know, so if, you know, that indeed becomes illegal in Ohio, so we're not there yet, but you know, I think that those are things that we need to be thinking about, you know, how our information is maintained, and, you know, access to childcare and equitable access to childcare. So as a regional campus member, I'm not a parent myself, but I know, you know, I work in Marion and I also work in Columbus. Those campuses are 40 miles apart. You can't have a child in daycare and be 40 miles away. And so that's a real struggle for regional campus faculty and associated faculty who are often working on multiple campuses. So the lack of access to childcare is such a huge burden on faculty at this institution. And is something, you know, this moment I think demands, you know, we talk about.
Myfli, I know that your work is embedded in looking at reproductive justice, even in different locations around the globe. So could you talk historically about what are some other models of advocacy that people have been using towards reproductive justice? And I bring this up particularly because I see that one of the attendees added in a comment of saying sometimes lobbying and protesting seems as though it may have reached its limit. And so how much needs to be actual legal advocacy, or what are the forms of grassroots activism that are still modeled in different places?
Yeah, thank you for that. It's a huge question. And I guess I would say, when I think about that, I mean, on the last part, I'm like, well, anything and everything, because as far as I'm concerned, we are in a moment of crisis. So if somebody wants and has capacity to do lobbying work, go for it. If your capacity is to, you know, support abortion funds, to help those in need, then go for that. I mean, I think we can do all of these things, but I guess I sort of look to two things. One, when we look in other parts of the world, and we see, because the US is an outlier right now, most parts of the world are actually making are trying to increase access to abortion and are liberalizing abortion law. So the direction that the US is going in is not in line with most other countries. And in the places where people have won greater abortion rights recently, that's like in Latin America, a number of Latin American countries, for instance. Also Mexico, where abortion was recently decriminalized in a major step. I mean, these are places that I think they have won through activism. And not just sort of activism in the abstract, but sort of making the point that people are going to get abortions whether or not they're legal. And in order to ensure safe abortion care on the one hand, and to ensure full citizenship for women and all folks who can become pregnant, it's sort of incumbent to liberalize the laws of abortion, right? And so you think about Argentina, for example, and these movements where people would wear green. I mean, it's a symbol, right? But people would wear green to sort of show their support for abortion rights and to show how widespread that support was. So I guess that's one, that's sort of like we can look to other parts of the world right now for success in rolling back restrictive abortion legislation. But secondly, if we just think about our own history in the United States, like abortion rights were a right that was won in this country. It wasn't just granted. And there were a lot of reasons why the Roe decision was made. But among them was simply the fact that people kept having abortions. And so there was a need. And secondly, that a women's movement, feminist movement, and other leftist organizations or progressive organizations made the case that abortion was essential for in their language, women's equality, but I think we could sort of broaden that out very substantially now. And so again, these are fights that people have won in the past. And these are fights that people are winning today. So, and the US is an outlier. So all of that together, sort of that does give me some hope about where we can change. And those past struggles were on all of those fronts. They were around pressuring legislators. They were around elections in places that had elections. They were around doing the work of sort of mutual aid to ensure that people who needed abortion care could get it, either by direct provision of services, right? If you've all heard about like the Jane Collective, for example, or through things like abortion funds that have supported people's needs to travel or otherwise access care. So I think it's a sort of all hands on deck moment in that sense.
Great. You heard me earlier in my introductory comment saying that part of the way, again, that Roe worked was to make a claim towards rights and privacy, but there's also a call to maybe shift the language from simply being about abortion as a women's rights issue and to think even more comprehensively. I was seeing over the weekend a book called, for example, Ejaculate Responsibly, that was thinking about shifting the abortion conversation to think more about the ways that men are involved in this conversation. I'll say, even, for example, from our registration rolls for this event, although it was publicly announced to the university audience, that most of the attendees are women. So what are the ways that we can enable for people who may be man identifying, or for someone who says, I'm 60, I've had my kids, this doesn't relate to me? What are some ways that we can start to shift or broaden the conversation about what reproductive care and reproductive justice means and who it impacts?
Quickly, I'd like to jump in here. We've already kind of started this conversation a little bit earlier when we were talking about how reproductive responsibility, the idea of guilt and shame has been placed on the individual identified with having a uterus, those capable of giving birth and carrying a child to term, and removing the male identifying folks from this conversation because it is seen, and I'm using quotes here again, as a women's concern, as a women's issue. This is a historical evidence and practice of a group of individuals being able to other themselves because of one, how the world, but our society specifically is built around this, who has the power, who does not have the power. And I guess let's kind of keep this ball rolling, the idea of like, yes, this is a terrible time to have these types of decisions in legislature being written, but it's also that time for advocacy and change, and to invite these individuals who maybe see themselves as othered or on the outside of this conversation to the forefronts. Now, that's a challenge in and of itself, because that's the nature of advocacy, but I think that's what we're going to need to do right now, because currently individuals don't see themselves. Individuals who phenotypically look like me don't necessarily see this as their concern or their problem, because it's not necessarily, in their opinion, infringing on their direct rights. Now, I think many of us who are here on this panel, we would feel otherwise about that and maybe believe that we understand how that is not true, because it affects all of us. But I think that's where the conversation needs to start. It starts with communication, and it starts with education, and it starts with bringing these people to the table to help them understand something that we're talking about today.
I think too, so I want to highlight, for example, the Advocates and Allies for Equity program fostered by the Women's Place, which really tries to draw together man-identifying colleagues to be able to think about what are their contributions to bearing additional responsibility for some of the programmatic work and practical steps towards gender equity. So I think that that's one thought, but also too on the issue of saying, well, some people say, well, this isn't related for me because I'm married, I have my children, or I'm past that age, or so on. I think that Raquel's work and the Franklin County Services, foster care, and so on, I want to go back to something that she mentioned about the likelihood of people having children that they were not prepared for is going to place additional pressure on foster care and on other public assistance programs. And so in that way, this does relate to many of us as individuals who want for there to be collective or community good. And so none of us is exempt from thinking about the implications of this conversation. As we move towards our concluding time, I'd like to just go and see if any one of you has something else that you'd like to contribute, maybe a particular call to action, memorable moment, or question that the audience departing should be thinking more about.
Well, I guess one thing that's coming out of some of the questions that we didn't get to because there were so many is sort of about somebody asked about what would employees at OSU say to a student who is maybe concerned about whether they should finish their degree in Ohio or matriculate to OSU. And then someone else asked a related question about what about Ohio State's sort of ability to attract and retain faculty. And I think these are all actually good questions that I have also thought about, and I'm not here to really answer them, but I guess one thing that does sort of give me hope at this moment is that although Ohio currently has one of the most restrictive laws on abortion with the 6-week ban, we also know from all the folks who do those public opinion polls that this is not, that the law that we have here at the moment in Ohio is not one that the majority of Ohioans actually support. And the level of restrictions that are being threatened by upcoming legislation is the same thing. And so this isn't so much an answer as just sort of an invitation to think really broadly about what's the space of our politics right now, that we are looking at expecting legislation that is so at odds with what so many people in this state believe? And what opportunities does that give us then, if we are the sort of voices of the majority, to change that, to make the law reflect more where many of us stand?
I certainly hate to end or make this sound like a pitch, but I do want to just remind everyone that some of this work is being done by some amazing student organizations as well. We only sponsor a few of them. And I think if we're talking about grassroots movements and individuals who are trying to kind of rise up and really be the next generation of advocates, find us, invite these students in, let them kind of speak on this platform. And for those of you who are in positions of power, whether that be staff positions, faculty positions here at the university, give them credence, give them the place to have these conversations and create that opportunity. And that's where the work, I think, is going to come from. The same thing can be said for the work that we're doing in the Student Wellness Center, inviting the wellness ambassadors, utilizing some of our resources, our education. Creating space is really the big takeaway message, because if you have the power to do so, I think that's almost a responsibility at this point.
Anything else from Raquel and Nicole? Raquel?
Oh, yeah. From a child services perspective, and I think about this even when we deal with our emancipating youth, how can we equip them to be successful? Well, whatever challenges there is, and I think one of the priorities has to be educating about what current options are, with the changes that are coming down, making sure that, when individuals that may be placed in a position where they're considering whether abortion or adoption, that they have access to the resources to have questions answered, to get the counseling, and just really having the opportunity to make an informed decision on what choices are out there.
Great, thanks.
And multiple sources or ways to get that information collectively from all community providers.
And for those looking for options for advocacy, what I think that I would just sort of uplift both everything that my panelists have said, and I will again name drop Women Have Options as a place to look for. They also partner with other organizations who are doing advocacy work. And I know that many of those organizations are, they've been doing the work for years, but they are open and excited about the energy around this issue, and are providing trainings that you can immediately get involved with. So I think Women Have Options is one place to look for information about that kind of advocacy work, if that's what you're looking for.
Great, thanks to all of you. Thank you again for all of the commentators today, and for the viewers who had plentiful and insightful questions. Today's conversation is inevitably only one part of what will be ongoing legislative struggle, grassroots activism, and social consequences related to reproductive care. And the Women's Place is proud to be able to provide a format for this discussion. Today's session has been recorded, and the playback will be available to anyone who registered. For more information about the Women's Place and previous conversations that we've hosted, including those about women's health and advancement, visit the News and Events tab for resources from previous events. And with that, I'd like to thank you for your support and wish you a good afternoon.